We're going to talk about something that might make you want to, but when it comes to going to the doctor, Albany Urology Clinic says prostate cancer screenings should be one reason that you do make an appointment. Now, here's one of their urologic surgeons on the prevalence of prostate cancer here in Georgia.
Prostate cancer is really quite common in the population, and some autopsy studies have estimated that more than 60% of men will have prostate cancer above the age of 70. And if I want to give you some specific stats, 1 in 9 men will be diagnosed with prostate cancer at some point during their lifetime. And in African Americans, that's a bit higher. It's like 1 in 6 men. And it's good to mention here that African Americans, when they're diagnosed with prostate cancer, it's usually a higher stage of prostate cancer when we compare them with other groups. And if I want to talk about the state of Georgia, it ranks 9th when compared to other US states in regards to the number of new prostate cancer cases.
Absolutely. And so when we talk about, looking at these statistics and the importance of screening, why is it important that men take that step and make that appointment?
So screening is very important, not just in prostate cancer, but in many other diseases, especially that we're in the era of preventive medicine. Screening is testing for a disease when you have no symptoms. So it is recommended that all men above the age of 50 have an extensive discussion with their primary care physician or their urologist about prostate cancer screening. And at some point, we recommend to have that discussion at an earlier stage, like at the age of 40 or 45, when there is a strong family history, or when we're talking also about African Americans.
So when we talk about these screenings, I think there's a little bit of fear in the unknown. What can people expect going into these type screenings? What's the process like? Is it scary?
No, nothing to be scared about. Nothing to be scared about. Screening is just about a simple blood test. We test a protein secreted by the prostate called a PSA. So it's just a simple blood test. And we look at the values, whether it's elevated or not, at the values of that PSA blood test. Before, when we used to get the PSA and we find that it is a bit elevated, we used to rush and tell the patient that we need to get a biopsy. But nowadays, we have several other tests that we can ask for, like some tumor markers in the blood or in the urine, or even ask for some images specific for the prostate, like an MRI. And the good thing that we're offering now at Albany Urology is genetic testing, because it was found that men who carry a gene called the BRCA gene or the BRCA gene are at higher risk of getting prostate cancer. So we're testing for that gene nowadays. And by the way, this is the same gene that was found to increase the risk of breast cancer in women.
Let's say we do see those elevated levels and you do the other tests and there is prostate cancer found in your patient. What is usually the treatment? What options do they have?
So treatment of prostate cancer usually depends on several things, mainly on the age of the patient and the stage of the disease. And the 3 main treatment modalities are what we call active surveillance, where we do just close follow-up with a patient with serial blood tests and sometimes imaging. And the other one is sometimes we have to remove the prostate surgically. And the good thing here in Albany is that we do that robotically. The third treatment option would be to offer some radiation to the patient. Of course, there are several other treatment modalities, but these are the main 3 options. And I would like to mention here that, again, the good thing about being here in Albany is that we're offering all standard of care treatment options.
Absolutely. Is there anything else you want to add maybe to the men that are watching this? One kind of final message to encourage them to go ahead and get screened?
Again, there is nothing to be scared about. As I mentioned, prostate cancer screening is just a simple blood test. Like, you don't need to be scared about that. And so if you're above the age of 50, just go discuss it with your urologist or your primary care physician. And there is no need, if you want to see us also, there is no need for any referral to see us at the office.
Awesome. Well, I appreciate you so much coming on and kind of educating us about this topic. Thank you so much.